Welcome to the Cord Blood Basics seminar series by Healthcord. In this video, we will explore stem cell therapies in more detail. Let's start by defining what stem cell therapy is. Stem cell therapy describes the use of stem cells to treat or prevent diseases. Scientists have been using hematopoietic stem cells for over 60 years to treat blood disorders and diseases of the immune system. Hematopoietic stem cells are stem cells that give rise to other blood cells and immune cells in our bodies. Cord blood is a source of hematopoietic stem cells. Hematopoietic stem cell therapies that are currently in use can be broadly categorized into two groups: allergenic stem cell therapies and autologous stem cell therapies. Allergenic stem cell therapy involves collecting healthy stem cells from a donor and transplanting them into a patient as a treatment option. Autologous stem cell therapy involves replacing the stem cells of a patient with his or her own healthy stem cells. For example, when autologous therapy is used to treat cancer, healthy stem cells are collected and extracted from a patient prior to chemotherapy. Following chemotherapy, damaged stem cells are replaced with the patient's own healthy stem cells. According to a survey from 2012, about 47% of hematopoietic stem cell therapies involve allergenic stem cell transplants. This means before a patient can be treated, you have to find a matching donor to provide them with a healthy stem cell sample. Let's look at allergenic stem cell therapy in more detail. The initial stages of this procedure involves taking stem cell samples from a donor, either using a blood sample or, in a majority of the cases, a sample from the bone marrow. In the next step, stem cells from these samples are purified using specialized antibodies. These selected stem cells are further processed before being transplanted or infused into a patient. Next, I want to highlight some of the limitations associated with allergenic stem cell therapy. First, you have to find a matching donor, a step that can be extremely difficult. Even with a matched sample, there's a high risk of rejection due to what is known as the graft versus host disease. This is a case where the immune system of the patient recognizes the transplanted cells as being foreign and starts attacking them. Next, bone marrow donation involves surgery. It is a surgical procedure which is invasive even for the donor. The final point to consider is that the age of the donor may be relevant because even stem cells age. Studies have compared stem cells from young versus older donors and noticed significant differences in robustness in these samples. You will want to explore our lesson on stem cells and aging if you want to learn more about this topic. I will end this video by highlighting some of the potential stem cell sources that are available for cell therapies. These include adult stem cells, which can be isolated from the bone marrow, and a variety of other tissues. Isolating adult stem cells can be difficult because the number of stem cells in our body decreases as we age. Induced pluripotent stem cells, or iPS cells, are another source that's been widely explored in the lab. These are stem cells made in the lab by reverse engineering adult cells. iPS cells have contributed to revolutionary discoveries involving stem cells in the lab. However, the safety and efficacy of using them for cell therapy remains to be established. Last but not least, we come to newborn stem cells. Newborn stem cells refer to stem cells from cord blood and cord tissue. The main limitation here is that newborn stem cells can only be collected at birth. Just as a recap, I talked about stem cell therapy, which refers to the use of stem cells to treat or prevent diseases. Cord blood and cord tissue are valuable sources of newborn stem cells. given that many clinical trials around the world are exploring the possibility of using stem cell therapy to treat a number of prevalent diseases like diabetes, Alzheimer's, osteoporosis, and arthritis, by choosing to save newborn stem cells today, you can improve the chance of your child having access to these therapies in the future. Still have questions? Feel free to explore our other lessons to learn more, or you can reach us at info@healthcord.com and we'll be happy to assist you.